Upstate Medical University in Syracuse, New York, invites you to be the informed patient with the podcast that features experts from Central New York's only academic medical center. I'm your host, Amber Smith. How do you teach new doctors how to care for patients who are having strokes? I'm talking about that with Dr. Hesham Masoud. He's a vascular and interventional neurologist who directs Upstate Simulation Center, and he's here to tell us about the Stroke Interventionalists Manual. Welcome back to The Informed Patient, Dr. Masoud.
Oh, thanks for having me, Amber.
The Stroke Interventionalists Manual falls into the category of graphic medicine. Can you describe what that is?
Graphic medicine is this evolving field in education in terms of its application. I'm sort of seeing it more and more develop. It's relatively new. The term was coined in 2007 by a British physician who was also a cartoonist, and he hosts the website graphicmedicine.org. The audience can be driven to that to find out more and see some examples. But the commonly used definition is it represents the intersection between the medium of comics and healthcare.
And it's showing up in medical school education?
Yeah, I think it's basically used at many medical schools internationally as something that is included into a medical humanities curricula typically. It's used to teach things like empathy, patient experience, aspects of communication, and complex medical concepts. It's typically a supplement. So it's not a replacement for textbooks or lectures or even simulation, and certainly not for the clinical experience, but it functions as this additional educational modality that can be used to really solidify some of the learning.
Why do you think emergency stroke care is a good subject for a graphic medicine treatment?
Because it serves many people, I think, in the sense that it's important, obviously, for the conventional medical learner, be it a nurse or a doctor or a physician's assistant. But also, really, the impact of emergency care has a lot to do with the public's awareness of the signs and symptoms of that condition that requires the emergency care. So it really is a partnership in ways that directly affect outcomes. And stroke is certainly representative of that model. There is this old adage, and I actually use it in the comic book, time is brain, and that's been quantified. Millions of neurons dying in seconds and the brain aging decades with every event is really something that signals that time is of the essence. And certainly while there are treatments, the maximum benefit is with a quick presentation. And so I thought emergency healthcare, because of these issues, is often very well delineated sequentially and very well timed, I should say, or linked to quality, be it clinical outcomes that we just talked about, or operational optimization outcomes, time to diagnostic test X versus diagnostic test Y. And so that sort of signature and necessary legibility for it to be used, I think, most optimally for a public awareness, in addition to, because of its sequential nature, being able to be relatively easily communicated, I think really lends itself to graphic medicine.
Well, what made you want to create an illustrated step-by-step guide to emergency stroke care?
It sort of sprouted from an exercise that I was doing for myself. I do like to cartoon a little bit and draw on some other things. And so I came across the CIA manual, which is this illustrated 15-page manual that everyone can Google online. It's called the Freedom Fighters Manual. You can get it on archive.org. The short story is I was looking at that, I have an interest in random things like examples of propaganda and in history. And I just thought it was really interesting how in that manual, they escalated what they taught from simple acts of sabotage, like just don't answer the phone or don't change a light bulb, for instance, all the way in the last page where there's depictions of riot and a manual instruction of how to sabotage a truck and how to build a Molotov cocktail. But what was interesting from a graphic medicine standpoint was just how they escalated. And they escalated in a way that was very legible. And the images they used were very disarming. It's cartoon images, and it's black and white, very visually arresting. These are signatures of propaganda, visually arresting, simple, repetition is a big piece of it. And my brain automatically went to, oh, this is sort of like escalating from giving the medicine, TNK, or the clot busting drug, all the way to the other procedure I do, which is physically retrieving clots. And because I do a lot of teaching, I thought, oh, it'd be kind of interesting if I could map on my knowledge onto this signature and sort of redraw the pages, but really be constrained by how much I could deviate from their visual style and how much the page resembled their black and white sort of odd visual style. That was really where it came out of, just sort of an exercise and a cross section of interests.
Well, it's an interesting comparison. And so with stroke care, what you've done is it shows the escalation from the most conservative treatment that might work all the way up to the most invasive. And then it's also easy to follow and understand with the drawings.
Yeah, I mean, like the first page in the original Freedom Fighters Manual is someone sleeping in front of their truck. And so what I have in my first page is the ambulance with an EMS person in front of the truck responding to a stroke patient who's displaying a very common stroke syndrome of sided weakness, which is very typical of a major stroke that would require not only clot busting, but also mechanical retrieval of the clot. So it's this idea of sort of paralleling from stroke recognition, even in the field, to the processes of how that information is distilled to the emergency medicine team, how that is then used to inform triage to treatment. And then I walk you through the tools and then the steps. And then we do a little piece about rehab, and it all has this tone that I infuse in there of comrade and call to action type of messaging. And I preface it with a couple of images that are not from the original manual, that are just sort of posters that I reappropriated to demonstrate the idea here being we're repurposing propaganda for public health. And it's worth noting that propaganda isn't inherently positive or negative. It's just a methodology that has these characteristics to it and this certain level of efficacy. And this was the idea of, hey, let's employ that for something else.
This is Upstate's The Informed Patient podcast. I'm your host, Amber Smith. I'm talking with Dr. Hesham Masoud, a vascular and interventional neurologist who has created the Stroke Interventionalists Manual. As I understand it, this is a fundraiser. People can obtain this book, pay what they like, and the money goes toward equipment at the simulation center. Is that right?
Yeah, the idea behind sharing this in a digital format also had a local bookmaker. We make up to 300 copies. And so there will be physical copies at this event for sale, and I'll sign them, was to have this be an enduring artifact of stroke education that could be called upon at occasions where one would want to do public education about health. And because it has this interesting aspect to it, it might capture the imagination year over year. And so I thought it might be a good way to drive funds towards the stroke program during Stroke Month, or to use it to drive fundraising towards the acquisition of materials that would be used to teach stroke in the simulation lab. So like a simulator, specifically a flow model, which is essentially tubing representation of the body's arteries and veins that can then be used to teach with real tools the mechanisms of how to treat things and how these devices work in the environment. It's a really great tool to have, and certainly would be used to teach a bunch of people, not only stroke doctors, but again, you can see here, it's just an idea of, okay, insert this for different fundraising opportunities. And again, I think repetition being a hallmark of propaganda, repetition is necessary for us to really get the public health message out and have it endure. And that's certainly a worthy endeavor when it comes to stroke care. So there's that overarching excuse to keep reminding people.
So this would be aimed at doctors, nurses, paramedics. What about high schoolers who are interested in medicine? I mean, how wide of an appeal could this have?
I think it can appeal to you on different ways. The physical book actually is this really interesting artifact. It's printed on paper that's similar to the original paper. It has a risograph style, which has its own imperfections that lend itself to the manual pamphlet. So because of its appropriation of propaganda and its association with politics that are sort of rhyming with contemporary issues, I think it might serve just common interest, and the material almost being secondary The intention was for it to have depth so that multiple layers are there in it for different readers. And people like me who have been practicing for a while could read it and be like, oh, yeah, that's how we do it. And that's an interesting setup because it's accurate to the minutia, but also be something that someone can follow who has no idea before they pick up the pamphlet what a thrombectomy is. So I'm hoping that this can be used in as many creative ways as people decide it to, but certainly for education of stroke, recognition, and a call to action being represented by more treatments being offered.
Can you tell us about the event at Parthenon Books in downtown Syracuse?
Yeah, it's a really cool partnership with the Upstate Foundation and Parthenon Bookstore, where they let me know there's this opportunity for them to host a book showcase and a mini fundraiser there where we could talk about the book. I figured we would stack on to that a public health talk that I give to EMS for stroke recognition and treatment. And so we kind of bundle it into the concept, and we may or may not be able to have an example of the product that we're trying to buy for people to see. But generally, it'll just be an opportunity to interface with myself and the stroke team, learn about stroke, an opportunity to support the program. You can certainly have access to the manual digitally for free on the website gumroads.com. There's a pay what you want model. The idea is to have Upstate engaged with the community and public health in new and interesting ways.
And what day and time is that?
So it's going to be at 11 o'clock. It's on June 27th.
What advice do you give students, whether it's paramedic students or medical students or nursing students, in terms of recognizing when a patient is having a stroke? What signs do they need to recognize?
This is really something that a lot of effort has been put into. There are these different acronyms. The one most commonly used is FAST, and then they add B FAST. This is essentially an acronym of B is for balance loss, E is for eye or vision changes, F is for facial droop, A is for arm weakness, S is for speech difficulty, and T means time to call emergency services. This is what people are generally using when you want a specific definition, but there are things that are missing here, like sudden numbness or sudden confusion of language in different ways that are not necessarily speech difficulty. So what I like to tell people is if there is a sudden onset subtraction of something that you could do. So there's suddenly something that is subtracted from you, that's a stroke until proven otherwise. That could be a sudden subtraction of balance. So now I am suddenly dizzy. A sudden subtraction of awareness. Suddenly I am confused. And certainly, like the other things that are represented in the acronym, these are sudden subtractions. I like to tell people about the theme of how the brain works and how the brain manifests its damage. And it does that by being a subtraction of its function and it being sudden in onset. That's a key concept.
Is that in the manual?
I use the FAST acronym in the manual, yes.
For listeners who are not medical providers, what do you believe that we need to know about stroke?
Same things as EMS in the sense that obviously EMS needs to know a little bit more about the minutia of syndromes for the purpose of triage and additional treatment that might occur en route to the hospital. But generally speaking, awareness of the symptom and the call to action being go to the hospital. Even if the symptoms get better, that doesn't matter. There were shots fired. We need to figure that out. And so I think the biggest thing is keep the brain in mind, understand that strokes don't hurt. And so that's why a heart attack, everybody knows you got to go to the hospital because it hurts. It's been called anger enemy, this impending sense that you're going to die. That doesn't happen with stroke. A lot of times people, their impulse will be to sleep it off or to think that they were fated by God. So there's a lot of that sort of healthcare apathy that sometimes exists within neurologic illness that we have to combat with education, and certainly stroke with its treatments and its benefits being so dramatic is really the tip of the spear, I think.
Well, good to know. And this book sounds really interesting. So thank you so much for making time to tell us about it.
Oh, well, thank you for giving me some time to talk about it. And it's worth noting that the book anchors the information that I use there with articles from peer-reviewed journals. So this information, I tried to make it have the same standards and rigor of anything that would be referencing something as important as stroke care.
My guest has been vascular and interventional neurologist Dr. Hesham Masoud, the director of Upstate Simulation Center and the creator of the Stroke Interventionalists Manual. The Informed Patient is a podcast covering health, science, and medicine, brought to you by Upstate Medical University in Syracuse, New York, and produced by Jim Howe, with sound engineering by Bill Brokel and graphic design by Dan Cameron. Find our archive of previous episodes at upstate.edu/informed. If you enjoyed this episode, please invite a friend to listen. You can also rate and review the Informed Patient podcast on Apple Podcasts, YouTube, or wherever you tune in. This is your host, Amber Smith, thanking you for listening.